Hey guys, welcome back to our YouTube channel, and today's our topic of discussion is maxillary division of trigeminal nerve. In previous two sessions, I have discussed with trigeminal nerve the introduction of trigeminal nerve, in which I have told you that trigeminal nerve is a mixed cranial nerve and it is the largest cranial nerve. And I have told about the three divisions of trigeminal nerve, that is ophthalmic, maxillary and mandibular, in which I have explained now ophthalmic division. And now today I am going to explain the maxillary division of trigeminal nerve. The maxillary is the second division of the trigeminal nerve. It is the purely sensory division, and it begins at the middle of the semilunar ganglia, continue forward in the lower part of the cavernous sinus, and leave the middle cranial fossa through the foramen rotundum to enter into the palatal fossa. After entering the palatal fossa, it gives some branches and then it runs forward to leave the palatal fossa through the inferior orbital fissure, enter the orbit. In the orbit, it runs in the infraorbital groove and give mainly two branches, anterior superior alveolar and middle superior alveolar nerve. And in the infraorbital groove, it's known as the infraorbital nerve, and then it exits through the infraorbital foramen to give its terminal branches. So this is the picture showing the pterygopalatine fossa, where the pterygopalatine ganglia is placed or located. It contains sphenopalatine foramen through which the branch of the pterygopalatine ganglia, nasopalatine branch, enters. And this fossa is present between the pterygoid plate and palatine bone. The areas supplied by the maxillary division of the trigeminal nerve are mostly lower eyelid, side of the nose, upper lip, maxillary teeth and their gingiva, mucous membrane of nasal cavity, hard and soft palate region, part of tonsillar region, and region of the pharynx near the opening of the auditory tube. Just like lower eyelid is supplied by the inferior papillopular branch of the maxillary nerve, side of the nose by the lateral nasal branch, upper lip by the superior labial branch, maxillary teeth in anterior superior nerve, and bicuspid by the middle superior alveolar nerve, and posterior molars by the posterior superior alveolar nerve, along with their gingivas, hard palate, anterior 1/3 by the nasopalatine, and posterior by the greater palatine, hard palate, soft palate by means of lesser palatine nerve, which is the middle palatine, and tonsillar region by the posterior palatine, and pharynx by the pharyngeal branch, which is the branch of the pterygopalatine ganglia. So these are the areas supplied by the branches of the maxillary division of the trigeminal nerve. Now comes to the branches of the maxillary division of the trigeminal nerve. First branch is the dural branch. So when the maxillary division leaves the middle cranial fossa through the foramen rotundum, before that it gives its dural branch, which is known as the middle meningeal branch, which run along with the middle meningeal artery. Then it enters the foramen rotundum, and first it gives the zygomatic branch, that is the zygomatic nerve, which leave the pterygopalatine fossa and enter the orbit through the inferior orbital fissure. In the middle of orbit, it divides into two branches, zygomatico-orbital and zygomatico-temporal. Zygomatico-orbital or zygomatico-facial nerve passes forward on the lateral orbital foramen and leaves by pursing the orbicularis oculi muscle and supply the sensitive fibers to the skin over the prominence of the zygomatic bone. Similarly, zygomatico-temporal nerve, which is second branch of the zygomatic nerve, leaves the orbit by passing through the zygomatic bone and greater wing of the sphenoid bone to enter the temporal fossa. Here it supplies sensitive fibers to the skin over the anterior temporal fossa region. Now, after giving the zygomatic branches, it maxillary division give the pterygopalatine nerves. These are the two short nerve trunks which unite at the pterygopalatine ganglia. In pterygopalatine ganglia, no synapse occur and the fibers redistributed into several branches, in which the branches mainly go orbital branches, palatine branches, or nasopalatine branch or sphenopalatine, or pharyngeal branches, and one branch is like fibers go in back into the pterygopalatine nerves through relay back into zygomatic nerve, and then zygomatic nerve meet the lacrimal nerve, and then fibers reaches the lacrimal gland. These are the post-ganglionic secretomotor fibers to lacrimal gland. So, secretomotor supply of lacrimal gland is as such. Preganglionic fibers reaches these pterygopalatine ganglia or sphenopalatine ganglia through the greater superficial pterygopalatine nerve. Here, relay of fibers occur. Then postganglionic fibers arises. They run back into the pterygopalatine nerves of the maxillary division. Through them, they travel back in the maxillary division, then to zygomatic nerve, and then zygomatic nerve meets the lacrimal nerve. The fibers run into lacrimal nerve, and via that they reach the lacrimal gland. So, lacrimal nerve, along with supply the sensory supply to lacrimal gland, but along with that, it also supply the secretomotor supply. Then, other pterygopalatine branches are the palatine branches. Palatine branches, first of all, greater palatine nerve, or we can say anterior palatine nerve, which is which supply the maxillary molars along with their palatal gingivas, and it run forward course. Then middle palatine nerve supply the soft palate, and posterior palatine nerve supply the tonsillar tract. Then ganglionic branch is also given to pharynx, that is the pharyngeal branch. Then we have nasal branches which go into the sphenopalatine foramen. And then we have some orbital branches which enter the orbit by the inferior orbital fissure and supply the periosteum of orbit and mucous membrane of the part of the posterior ethmoidal cells and sphenoid sinus. Then comes the posterior superior alveolar nerve. So it is also given in the pterygopalatine fossa. It runs downward and continue on the posterior surface of the maxilla, and it run through the posterior superior alveolar canals and supply the posterior wall of the maxillary sinus and maxillary molars along with their gingiva. Then, after giving these three branches, that is zygomatic, posterior superior, or pterygopalatine branches, the maxillary nerve take its further forward course, enter the orbit through the inferior orbital fissure, and turn in the infraorbital groove or canal. Here, it gives two branches, anterior superior alveolar nerve and middle superior alveolar. So comes to the middle superior alveolar nerve, which join with the other alveolar nerves to form the superior dental plexus. If middle superior alveolar nerve leaves the infraorbital nerve in the posterior part of the floor of the infraorbital canal, then it passes in the downward and anterior direction toward the bicuspids of the bicuspid and supply them. If it leaves the infraorbital nerve in the floor of the infraorbital canal near the infraorbital foramen, then it passes downward in the anterior direction and supply the anterior lateral wall of the sinus, maxillary sinus. And sometime in middle superior alveolar nerve is missing. Then bicuspid receive the sensory innervation from the superior dental plexus. After middle superior alveolar nerve, infraorbital give the anterior superior alveolar nerve branch, which descend from infraorbital nerve inside the infraorbital foramen in the anterior part of the infraorbital canal, and it supplies the central, lateral, or cuspid, and also gives some connective fibers to superior dental plexus, and it also supplies the mucous membrane of the anterior part of the maxillary sinuses. Then infraorbital nerve leaves through the infraorbital foramen and gives its terminal branches. First is the inferior palpebral branch to the lower eyelid, then external nasal branch to the skin of the side of the nose, and then superior labial to the skin of the upper lip. So this is all about the maxillary division of the trigeminal nerve. Hope you all like my video, and if you have any query, you are free to ask from us. Thank you. Have a nice day and kindly subscribe our channel.